So a lot of people ask, how do you get a Rockstar team? You don't go out and hire them, because we've tried to do that. We've tried to hire people, spend a lot of money and pay way over our normal rate to get a Rockstar team in. That never seems to work. It seems like when we create the Rockstar team is when we get the Rockstar team. So how do you create a Rockstar team? You gotta have systems. If you have systems in your business, no matter what it is, it'll run better. If you have systems in your practice, it will run better. As you grow, look, chiropractors, I'm a chiropractor, I love chiropractors. We tend to be personality-driven businesses. We get the idea that we want to start our own practice. We recognize, when I went to school, we knew we weren't going to get any referrals from the medical world. That's changed a bit, but we still knew that. And I wanted to start my own business. I knew I was going to have to be responsible for getting my own patients out there somehow, some way. You get the business, you do the marketing, you get people in, and now you're seeing them. And if you're a personality-run business, you're handling every problem. And what usually happens is chiropractors hire people as they go, I can't possibly answer the phone and treat these patients. I need somebody else how to answer the phone. And then sometimes when they hear how they're answering the phone, they're like, oh my God, you said what? What, are you crazy? That's not the employee's fault. That's the business owner's fault. You have to have systems on how they answer that phone. You have to have systems on how they greet a patient, how they fill out paperwork, how they get them back to a room, how they schedule their appointments, how they confirm their appointments. You need systems on all this stuff. But I don't know how to do systems. That's the problem. What we've done over the years is we've created systems. My wife and I knew we wanted to have multiple practices. We knew we wanted to have a bigger reach and get to more people. And how do you do that? You can't run the whole show by yourself if you don't have systems. Even the Army says, you know what, you should only have a few people that you are in charge of as you go through the ranks of the Army. It's called the chain of command, because people have to have systems and know what to do, and you need to depend upon them if you're going to build your business. If you try to do it all yourself, there are some people that can do some pretty amazing things, and I've met them. Some of our clients have done extraordinary things, more than the average person could do, but everybody has their limit. There's going to be a point where if you keep trying to grow, it's going to burn you out. But we need to get people to get more chiropractic. There's a lot of people out there that don't get chiropractic. 9 out of 10 people don't get chiropractic. How do you get the rest of the population to experience it? They're afraid of it, they don't know what it is, they think we rip them off. But you say, oh, that was all created by the drug companies. Who cares who created it? We still got to deal with that problem. So how do you get them to experience it? If you can get them to experience chiropractic and realize, oh, now I know what this does for me. I feel great. Whatever they did to me, that was not uncomfortable, and I have abilities now that I didn't have. You got to get them to experience it. What we try to do is we get them to try to experience it in a medical setting. It doesn't mean we're prescribing drugs. We're not doing that. But we're doing it in a setting where there are medical providers who want to help people avoid drugs and avoid surgery. To do that, or to do any other type of business, you need to have systems so that those employees, as you get more and more of them, know how to do their job. And they don't have to keep running to you and say, what do I do with this? That you have a chain of command that they can actually get help with, which means you have to figure out the scenarios of what people are going to run into and how they handle that. That's how you get your system or your business to be system-based. That's how you get it to run really efficiently. And that's how you get it to grow bigger than you could possibly do it as being a personality-driven business. A lot of people like the idea of having a system-driven business and a large business, but they just don't want to go through the pain of the systems. We have systems. We have lots of systems. We do training live. I'm sitting in our classroom right now. We do trainings here every month. We fill this room and we have people here and we train for 2 days. We do trainings every week, and they're live virtual, meaning we have Zoom calls with our clients where we have certain topics that are discussed on different calls. We do at least 2 of those a week. Then we also do training online, where my wife and I have done these videos and tons of other videos on training, on putting out the systems and explaining how the systems work, and then breaking those systems down into subsystems. For example, our rehab program must have hundreds of videos. Each individual exercise is a separate video. How to diagnose each individual muscle condition, whether it's too tight or too weak, has a separate video. So you could look at all these videos and you could have your employees studying it. Let's say you send your nurse practitioner to our training and she wants to learn how to diagnose upper cross and lower cross syndrome. We teach how Dr. Yanda figured that out. He was a medical doctor. And we teach him how they could diagnose it. And once they have that information, then they can think with that on their own. But let's say they forget one muscle, just one muscle out of the whole weekend. They can go online and look up that one muscle and watch the video on how to diagnose it and how to correct it. That's what systems are. Having it in a way that you can actually utilize that material, that information, and have it function in your business without it having to be you doing all of the work and you correcting everybody. What you do is you set up a team. You set up a team where they can practice, where they can train, where they can learn, and where they can be corrected. And when you have that all in place, that's like a quality control system. Now you're going to find that you have businesses running and you don't have to jump in and fix everything, which means you can focus on your next practice if you want to. Or how about this? Here's a crazy idea. How about taking a vacation with your family? I can't tell you how many chiropractors I've met that said, yeah, I don't take vacations because the hit that my practice would take if I'm not there, I can't afford to do that. So I just take long weekends. That's not fair. You guys deserve a vacation too. Chiropractic is tough on the body. It's very physically demanding. Basically, you should have systems in place that you can go away and have your practice continue to function in your absence, and the quality of care should stay the same. I can't tell you how many chiropractors say, yeah, when my patients figure out I'm going away, they say, when's he coming back? Because I don't want to get adjusted by anybody else. That's because they've been trained to only want the type of treatment that that chiropractor does. A lot of us like to think we're the best. I thought I was the best, but I realized we're not all the best. We're all good. There's some exceptional chiropractors out there. I think I'm one of them, but the true exceptional chiropractor is the one who can teach others to be able to do what they do. And sometimes I run into chiropractors and they feel like, oh, this is the secret sauce, I'm going to give it away. Only if you want to grow bigger. Your job should be to take that data that's in your head and teach that, because that probably is bigger in content than what you can do with your hands. Think about that. You get to a point where you have to go, if I don't teach this to somebody else, the secrets that I have are going to die with me. A person who had that realization was D.D. Palmer, the founder of chiropractic. He didn't want to teach it to other people. And his son, B.J. Palmer, was saying to him, you need to teach this. You need to create a school. And he's, no. And then something happened where D.D. almost died, and he realized he's right. If I die, this whole secret dies with me. He got a deaf man to hear again after being deaf for 17 years by adjusting his spine. Could you imagine if he never figured out how to teach this to other people, what would be lost? That would be a real shame. And the same is true for what you can do for patients. If you're that good, you owe it to your community to teach others to carry on in your absence. And if you do that, now you can take the knowledge in your head and put that to work, creating more practices. That's what I'm all about. The world needs now is more chiropractic, not less. And the only way you're going to get more out there is to have good systems to get your employees trained to be able to perform without you having to be there to fix everything. So if you like this content, then subscribe, leave a comment. Talk to you next time.